There are lots of barriers to employment that a work requirement will not fix. So the barriers to employment generally are transportation, access to quality childcare and elder care, and then addiction issues. And so requiring people to work is not going to resolve any of those problems. On the face of it, it seems like a good idea. If people aren't working, then let's require them to work as an incentive, or it's not quite an incentive, it's a requirement. However, most people want to work already. Most people want to overcome whatever barriers to employment there are in their lives, and so giving them one more barrier is not super helpful, and the results are counterintuitive to, I think, what's trying to be achieved here. If someone loses health care because of work requirements, that makes them less employable. It's pretty clear to most employers that they want healthy people working for them. If someone doesn't have access to health care, they're less likely to get proactive healthcare, which means they're going to encounter healthcare crises more often. And so again, that's another impediment to employment. If we truly want to encourage more adults to join the workforce, then we need to fully fund job programs, fund quality childcare, fund quality elder care, and fund mental health programs. Medicaid is a healthcare program, not a job program. Workforce Tulsa and other programs like ours are job programs. And so I think it makes sense that if you want more people in jobs and you want more jobs filled, then it makes sense to fund job programs. I just think it's short-sighted policy that is potentially very damaging, not just to job seekers, but to companies who desperately need good skilled workers to fill jobs. So I'm concerned not just from the individual standpoint, but from the standpoint of employers in Tulsa. We have a very low unemployment rate currently. We have a very low labor participation rate, lowest since the 70s, which means we really can't waste anyone. Companies need absolutely everyone who's available for work to be working, and obviously they need transportation to get to the job. They need access to childcare and elder care, and they need to be mentally and physically well.